Dear colleagues, this is a very small capsule orexis 4.5 to 5 millimeter orexis, small enough to make sure the IOL will be well centered inside the bag. And this is a 66 years old patient that undergo phacoemulsification for a multifocal lens. So I apply in this case a stop and chop technique. First head a trench and separate the nucleus into two large fragments, and then like a V shape or Y shape, I make another small trench and separate a small slice of one of the heavy nucleuses in order to be able to emulsify the slices very small and at below the iris plane, below the rexis plane, right in the middle of the bag. Every half of the nucleus is divided into 8 small pieces to make sure the amount of ultrasound that is used is very, very low, and keeping the phaco probe in with the bevel down inside the bag. Phacoemulsification is done almost at the middle of the nucleus, and that will ensure a clear cornea the next day. It's especially important in these patients that have multifocal lenses or toric lenses, and the amount of energy that you can use, it's very, very low, since you keep the parameters and the phacoemulsification at a lower level. Aspirating the cortex and the epinucleus is done in a routine fashion. You can do it with a Simcoe cannula, irrigation aspiration probe, or any way you like it. I'm doing it here with irrigation done by AC maintainer, and aspiration is done with the aspiration needle. Once you clear the bag very well, I inflate the bag with viscoelastic and injecting the PanOptix multifocal IOL from Alcon is done under viscoelastic protection with a bag full of viscoelastic agent. Notice the fact that there are just 2 incisions, and they are kept in the upper quadrant, so that will minimize the astigmatism that you can induce on phacoemulsification surgery. Having a small capsulorhexis helps to keep the optic of the IOL well inside the bag and centered well, is no issue. The patient had a crystal clear cornea the next day and great vision, so everybody was happy. At the end of the surgery, I place, after I clean up the bag of any remnants of viscoelastic, I place some Myacol to constrict the pupil. Thank you very much for your attention. I hope this will help you in your practice also.